Kate. I'm a physical therapy intern. I will be working with you today. So I just want to let you know I've already washed my hands, and I'm just going to ask you a couple questions before we can get started.
Sure.
So, do you have a history of any active hemorrhages?
Nope.
Any PVD history?
No.
Any pacemakers?
Nope.
Okay. And then any bones with active osteomyelitis?
Nope.
Okay. And then other contraindications are pregnancy, except he is a male, so we won't have that issue. And then you can't place the electrodes over the heart. So some precautions with this modality are if the patient has communication issues, if there's any neoplasms, cardiac dysfunction, hypertension, diminished sensation, skin allergies, epilepsy, or seizure disorders. And then you can't do this treatment within 5 yards of a patient receiving diathermy. So we will be using this modality because our patient has pain and muscle spasms, but you can also be using this modality if the patient has inflammation, ossifications, scar tissue, wounds, and tissue ischemia. Based on his symptoms, and since he doesn't have any contraindications, Iontophoresis is going to be our chosen modality for our patient today.
So for this modality, I'm going to have to put my hands on you. So do I have your consent to continue on with this modality?
Yes, you have my consent.
We're going to be putting it on our patient's extensor, so I'm going to inspect the skin. Looks good. We do a capillary refill within normal limits, and then we're going to clean his skin. For this treatment, you're going to be feeling a slight tingling. If it starts to hurt, just let me know. If it's like super painful and you can't tolerate it anymore. So normally the treatment will last 10 to 20 minutes, except for our purposes, we're only going to be doing a few minutes. For this treatment, there's going to be 2 electrodes. One is the electrode that has medication on it, except for this case we'll be using 3 milliliters of water, and then we have the inactive electrode. The active electrode is going to be receiving the medication. So we have 3 milliliters of medication. And then I'm going to saturate the active pad with it. And so this is going to go where a majority of his extensors are. And then the inactive electrode will go slightly farther away. And then we're going to hook up the white wire to the active, or to the medicated electrode, and the dark gray to the inactive. So for the parameters for this, we're going to be using a direct current. The dosage range is going to be 20 to 80 milliamps. The amplitude is going to be 0.1 to 4 milliamps at the highest. And then I'm going to monitor the patient, and this should be applied no more than every other day. So we will get started with our treatment. So Stan, let me know when you feel.
Sure.
So we have polarity, dosage. Okay, and I'm going to put it up to a little bit. Do you feel anything?
I'm feeling a little bit. Go a little higher.
A little higher?
Keep going. Keep going. Keep going. Keep going. That's good.
Okay. So we'll keep him here and monitor him until the treatment is over. The treatment is done, so we're going to turn off the machine. So you have to hold it to turn it off. So we'll remove the electrodes. After I remove the pads, we're going to do a capillary refill. It's within normal limits. From this treatment, I have to check the skin, and normally there might be some redness for most patients who use this. Skin changes are common. There might be reversible redness, irritation, tingling or itching are very common. So you can apply a cold pack if that is bothering you. And that is it for today.